ममता की छाव सी, माँ के प्यार सी, माँ के दुलार सा करे देखभाल। जो समझे आपके उस एहसास को, आँखों के तारे सा रखे ख्याल।
विश्वास और भरोसे की उम्मीद। डॉक्टर कमल महाजन चिल्ड्रन मल्टी स्पेशलिटी हॉस्पिटल आपके कोमल बच्चे की करे कोमलता से देखभाल। आपके नए जन्मे बच्चे के लिए ऐसी उत्तम और आधुनिक सेवाएं अमृतसर में पहली बार। डॉक्टर कमल महाजन चिल्ड्रन मल्टी स्पेशलिटी हॉस्पिटल में।
Congratulations! Your baby has entered a new world. The transition from the mother's womb to the outside world is a big step for babies, and they face a lot of challenges to be with us in our world. Welcome to the Neonatal Intensive Care Unit of Dr. Kamal Mahajan, where we believe in high touch rather than high tech. A place where mothers are not just visitors, but they are our partners in the development of the child. Because your baby has a unique personality waiting to be discovered by you. For almost 4 decades, Dr. Kamal Mahajan Multi-Speciality Children Hospital has been imparting its medical expertise in the most skillful manner and has a resounding success ratio. In its journey so far, it has given a healthy lease of life to more than 25,000 babies. Our belief is our strength. We have an undiminishing value for child health care, and to say the least, the hospital cures more than 1,800 premature babies almost every year in its NICU, which has state-of-the-art equipment and is of international standards.
My mission is to provide the excellent care to my patients. I want them to leave the hospital with a smile on their face, and I want the parents to feel that they have been provided with the best care health facilities.
My vision is to make an honest, empathetic and impactful team who wants to give the best care in our field. We want to make a different positive impact in the universe, and the babies keep smiling and growing.
The NICU of a hospital is a place where we believe in giving a complete 5 senses care to the baby. Besides having latest technology and life support systems, our emphasis is more on high touch, giving it a greater emotional angle between the child and the parents. Time schedule in the hospital is met with utmost punctuality. The handover time is 8 a.m. to 8:30 a.m. and 8 p.m. to 8:30 p.m. During this period, visitors are not allowed, and the designated nurses give report about each baby, maintaining the confidentiality, checking medication, managing IV fluids and infusions, giving blood products, recording observations, and documenting all that is required for the baby's care. After a 6-hour cap, the baby is refreshed again and is cleansed, sponged, bathed, massaged, change of nappies, sheets, and repositioned for another good sleep. Strict measures are in place to prevent any kind of infection in the NICU. Before one enters and handles the baby or the baby equipment, a 2-minute hand scrub is a must. Alcohol hindrance is applied on hands before examining the babies, and sterilization of entire space and equipment is done under strict supervision. Transportation of the baby is a very crucial and critical task. A baby needs the environment and temperature similar to that of the mother's womb. So to transfer a baby from other centers, an embrace warmer is used to prevent hypothermia, and it helps to keep the baby at 37 degrees centigrade for 4 to 6 hours. Once admitted in the NICU, the newborn baby is examined under the warmer. The baby's weight, crown to heel length, head circumference is measured with precision. Observation of the color of baby for cyanosis or jaundice, tone, activity, and reflexes like palmar grasp, plantar grasp, and moro reflex, etc., are done very carefully. The baby is also checked for any kind of congenital malformation, if any. Massage is of vital importance in the development of the baby. It is given by experts and is joyous for the families also. Moderate pressure is applied, and this helps the baby in improving the sensory stimulation besides boosting the immune system. Better weight gain, better sleep, better motor maturity score are other factors associated with it. Post massage is the feed time for baby, and this act is done with great care. The required amount of milk is measured and poured in a paldies. There is a procedure to drink the milk through paldies. After feeding, the baby is burped and put to sleep. We don't use feeding bottles in our NICU.
ਬੱਚੇ ਦੀ ਮਦਰ ਫੀਡ ਅਸੀਂ ਆਪ ਖੁਦ ਪ੍ਰਿਪੇਅਰ ਕਰਦੇ ਹਾਂ, ਬਿਲਕੁਲ ਸਟਰਲਾਈਜ਼ ਤਰੀਕੇ ਨਾਲ। ਅਗਰ ਮਦਰ ਨਹੀਂ ਆ ਸਕਦੀ ਤਾਂ ਅਸੀਂ ਫੀਡ ਮਤਲਬ ਕਿ ਪੇਰੈਂਟਸ ਤੋਂ ਮੰਗਵਾਉਂਦੇ ਹਾਂ ਕਿ ਉਹਨੂੰ ਟਾਈਮ ਟੂ ਟਾਈਮ ਮਤਲਬ ਕਿ ਮਦਰ ਦੀ ਫੀਡ ਮਿਲੇ, ਜਿਸ ਨਾਲ ਉਹਨੂੰ ਪ੍ਰੋਬਲਮ ਨਾ ਹੋਏ ਕੋਈ ਵੀ ਇਨਫੈਕਸ਼ਨ ਤੋਂ ਪ੍ਰੀਵੈਂਟ ਕਰਨ ਵਾਸਤੇ।
From blood tests to x-rays, everything about the baby is recorded properly. For blood test, minimal amount of blood is taken, and for x-ray, the baby is seldom raised from the cot, as portable machines are used to do the same. Every day, doctors are examining your babies. They go through the vital signs and the events that took place in the last 24 hours. The lab results and diagnostics tests, and with all the information they put together a plan for the rest of the day. Our dedicated staff provides individualized care and supports the need of the infant, minimizing the level of stress and pain in them. The key is to maintain the healing environment at the NICU, temperature and touch, position and movement, smell and taste, hearing and noise, vision and light. All these are very important, and any environmental hazard can affect brain development and functioning of the body. In the NICU of our hospital, the thrust is on creating an atmosphere in which the parents and the newborn are at ease with each other. The idea is to make it a family affair. The family is not only a visitor here, but they are also the partners. The parents are here allowed to hold on their babies most of the time. We recognize that the family is the constant in the child's life. Lead to best outcome, show complete, clear and unbiased information, enhance the quality and safety of healthcare. Our support group organizes educational sessions every Tuesday, 2 p.m. to 3 p.m. on breastfeeding, kangaroo care, pumping, feeding, nutrition, development milestones and care of newborn babies. To maintain neuroprotective environment, the baby is kept in dark or minimal light, and all the alarms are turned off to minimize the sound level. The quiet environment ensures uninterrupted sleep. This quiet time is of great help in brain development and functioning of the body. The quiet, dimly environment mimics utero experience for the baby.
जब बच्चा माँ के पेट से बाहर आता है, सबसे इम्पॉर्टेंट होता है उसे वही माहौल यहाँ पर देना जो उसके लिए बहुत ज़रूरी होता है। इसलिए हम उसके लिए एक नेस्ट तैयार करते हैं। नेस्ट में बच्चे को उसी तरह की पोजीशन दी जाती है जो पहले बच्चे को माँ के पेट में मिल रही होती है, ताकि बच्चा एक सेफ फील करे, उसे माँ जैसा ही फील आए।
Kangaroo mother care is a unique and an important factor in this entire process. We believe touch is the biggest healer, hence the concept of skin-to-skin contact, which is another neuroprotective intervention. Your baby's skin to skin care is one of the biggest factors in development supportive care. The skin to skin contact has favorable results. There is increased milk production in breastfeeding mothers, better physiological stability, increased maternal confidence, and enhances the bond between mother and child. There are many amazing benefits of kangaroo care, and mothers should practice this as long as possible. The KMC process enables the baby to listen to the heartbeat of the mother, and apnoea chances are much less. The baby also recognizes the voice and smell of the mother, which helps in the baby's growth and weight gain.
ਅਸੀਂ ਬੱਚੇ ਨੂੰ ਇੱਕ ਐਜ਼ ਏ ਮਦਰ ਮਤਲਬ ਟਰੀਟ ਕਰਦੇ ਹਾਂ ਕਿ ਬੱਚੇ ਨੂੰ ਕੋਈ ਮਦਰ ਦੇ ਮਤਲਬ ਸੈਪਰੇਟ ਹੋਣ ਤੋਂ ਬਾਅਦ ਵਿੱਚ ਕੋਈ ਪ੍ਰੋਬਲਮ ਨਾ ਆਵੇ ਅਤੇ ਅਸੀਂ ਉਸ ਨੂੰ ਮਤਲਬ ਕਿ ਇਮੋਸ਼ਨਲ ਥੈਰੇਪੀ ਇੱਕ ਸਪੋਰਟ ਦਿੰਦੇ ਹਾਂ ਕਿ ਇੱਕ ਟੱਚ ਥੈਰੇਪੀ ਦਿੰਦੇ ਹਾਂ ਕਿ ਬੱਚੇ ਦੀ ਗਰੋਥ ਅਤੇ ਡਿਵੈਲਪਮੈਂਟ ਹੋਵੇ ਔਰ ਟਾਈਮ ਟੂ ਟਾਈਮ ਉਹਦੀ ਫੀਡ ਔਰ ਉਹਦੇ ਸਲੀਪਿੰਗ ਟਾਈਮ ਮਤਲਬ ਕਿ ਐਡਜਸਟ ਕਰਦੇ ਹਾਂ ਕਿ ਬੱਚੇ ਨੂੰ ਕੋਈ ਵੀ ਪ੍ਰੋਬਲਮ ਨਾ ਆਵੇ ਵੀ ਸੈਪਰੇਟ ਹੋਣ ਤੋਂ बाद मदर ਤੋਂ।
बच्चे को हम एक दर्द थेरेपी देते हैं जिसके थ्रू बच्चे को ये महसूस होता है। इसके अलावा हम मदर के साथ बच्चे का एक टच रखने के लिए एक अलग से थेरेपी भी इस्तेमाल करते हैं जिसमें हम एक क्लॉथ का इस्तेमाल करते हैं जिसे काफ़ी देर तक मदर की टच में रखा जाता है और उसके बाद उसी क्लॉथ को बच्चे के टच में रखा जाता है ताकि उससे बच्चे को अपनी मदर का एक टच महसूस हो सके, उसे स्मेल कर सके क्योंकि ऑलवेज ये कहा जाता है कि बच्चा अपनी मदर को स्मेल करता है। तो उस चीज़ के लिए हम इस थेरेपी का भी इस्तेमाल करते हैं।
Therapeutic posting in the NICU is of paramount importance and can influence the neuromotor and musculoskeletal development besides physiological function and stability, skin integrity, thermal regulation, bone density, sleep facilitator and brain development. To ensure the wellness, the body is placed midline, flex contained in a comfortable position, utilizing positioning aids and boundaries and promoting hand-to-mouth contact. Your baby has unique ways in letting you know about certain things. Let us review some of these timeout signals. Color changes, changes in vital signs, gagging hiccups, spitting up, yawning, fingers playing, trunk hyperextension, frantic flailing movements, glassy-eyed appearance, gaze aversion, starring, panic look, and irritability. These signs reveal that your baby is unable to interact socially, and subsequently, the interaction signals are such as a quiet alert state, brightening and color of eyes, regular breathing patterns, focusing of attention on stimuli presented. This is the good time to interact with your baby.
ਮੇਰੇ ਘਰ ਬੇਟਾ ਹੋਇਆ 22/4/2016 ਨੂੰ ਵਿਦ ਗॉड ਬਲੈਸਿੰਗਸ ਬਟ ਸਾਨੂੰ ਬਰਥ ਤੋਂ 2 ਘੰਟੇ ਬਾਅਦ ਪਤਾ ਲੱਗਾ ਕਿ ਵੀ ਸਾਡੇ ਬੇਟੇ ਨੂੰ ਬਰੀਥਿੰਗ ਪ੍ਰੋਬਲਮ ਹੈ। ਅਸੀਂ ਫਿਰ ਦਵਾ ਡਾਕਟਰ ਨੇ ਸਾਡੇ ਡਾਕਟਰ ਪੂਨਮ ਨੇ ਉਹਨਾਂ ਨੇ ਰਸ਼ ਕੀਤਾ, ਅਸੀਂ ਕੁਨਾਲ ਮਹਾਜਨ ਸਰ ਕੋਲ ਰੈਫਰ ਕੀਤਾ ਉਹਨਾਂ ਨੇ ਸਾਨੂੰ। ਅਸੀਂ ਇਹਨਾਂ ਕੋਲੋਂ ਆਏ, ਸਾਨੂੰ ਪਤਾ ਲੱਗਾ ਸਾਡੇ ਬੇਟੇ ਨੂੰ ਇਨਫੈਕਸ਼ਨ ਹੋਈ ਹੈ, ਲੰਗ ਇਨਫੈਕਸ਼ਨ ਹੈਗੀ ਸੀ। ਇਮੀਡੀਏਟਲੀ ਵਿਦ ਇਮੀਡੀਏਟ ਇਫੈਕਟਸ ਇਹਨਾਂ ਨੇ NICU ਵਿੱਚ ਬੱਚੇ ਨੂੰ ਐਡਮਿਟ ਕੀਤਾ, ਕੇਅਰ ਕੀਤੀ। ਪਤਾ ਲੱਗਾ TLC ਵਗੈਰਾ ਕਾਫੀ ਜ਼ਿਆਦਾ ਹਾਈ ਸੀਗਾ। ਨਰਸਿੰਗ ਸਟਾਫ ਇਹਨਾਂ ਦਾ ICU ਵਗੈਰਾ ਸਾਨੂੰ ਦੇਖ ਕੇ ਕਾਫੀ ਸੈਟਿਸਫੈਕਸ਼ਨ ਹੋਈ ਕਿ वी आर ऑन अ राइट प्लेस एंड माई बेबी इज ऑन राइट हैंड्स।
मेरा बेबी नव्यांश सिंह यहाँ पे एडमिट हुआ था। जिस दिन उसका बर्थ हुआ था उसी हाफ एन आवर के अंदर उसे ब्रीथिंग प्रॉब्लम हो गई, तो यहाँ पे कॉल करा तो ये एकदम से आए, इन्होंने मेरा बेबी लिया और उसको इतना अच्छा ट्रीटमेंट दिया। डेली मैं तो आ नहीं पाई, मनदीप मेरे हस्बैंड ये आ रहे थे उसका केयर देखने के लिए, तो जो आके मुझे बताते थे मुझे रिलीफ मिलता था कि हाँ मेरा बेबी एक अच्छे हैंड में है। फिर आफ्टर 4-5 डेज़ जब मुझे वहाँ से रिलीफ मिला, मैं यहाँ पे आई, मैंने देखा मेरा बेबी ठीक था। डेली रोज़ 6 डे 7 डे 8 डे मेरा बेबी मुझे अच्छा मिला। फिर लास्ट 7 डे मेरा बेबी मुझे मेरे हाथों में मिल गया था।
ਅਸੀਂ ਮੇਰੇ ਬੇਬੀ ਨੂੰ ਲੈ ਕੇ ਆਏ ਸੀ ਇੱਥੇ ਲਾਸਟ ਮੰਥ ਵੈਨ ਸ਼ੀ ਵਾਸ 2 months 10 days old ਐਂਡ ਸ਼ੀ ਹੈਡ ਅ ਕੰਸਿਸਟੈਂਟ ਫੀਵਰ। ਫਿਰ ਇੱਥੇ ਟੈਸਟ ਕੀਤੇ ਗਏ ਸੀ, ਡਾਇਗਨੋਸਿਸ ਵਿੱਚ ਇਨਫੈਕਸ਼ਨ ਆਈ ਸੀ ਐਂਡ ਸ਼ੀ ਵਾਸ ਐਡਮਿਟਡ ਹੇਅਰ ਫॉर 3 days ਐਂਡ during our stay here she was looked after very well by the staff and doctors who are very professional and have high ethical standards।
सारे डॉक्टर्स हॉस्पिटल स्टाफ का थैंक्स कर दिया कि बेबी बिल्कुल ठीक हो गया, नवी लाइफ मिलन वाला हिसाब होया। थैंक्स टू ऑल।
ਅਸੀਂ ਕਾਫੀ ਪਰੇਸ਼ਾਨ ਸੀਗੇ ਜਦੋਂ ਅਸੀਂ ਇੱਥੇ ਆਏ ਸੀ ਕਿ ਸਾਨੂੰ ਨਹੀਂ ਸੀ ਪਤਾ ਕਿ ਸਾਡੇ ਬੇਬੀ ਨੂੰ ਕੀ ਹੋਇਆ ਹੈ, ਕਿਉਂ ਇੰਨਾ ਬਿਮਾਰ ਹੋ ਗਿਆ ਇੱਕਦਮ। पर जिहड़ी सपोर्ट एंड जिहड़ा होमली एनवायरनमेंट इत्थे मिलिया वो काफ़ी हैल्पफुल सीगा एंड 3 दिन विच साडा बेबी ठीक हो गया सी एंड वी टुक हर होम एंड वी रियली एप्रीशिएट द एफर्ट्स दैट डॉक्टर कमल महाजन चिल्ड्रन हॉस्पिटल इज़ मेकिंग इन दिस फील्ड। वी रियली अपलॉड देम।
2 दिन पहले यहाँ पे मैंने अपना बच्चा एडमिट किया रात को, एमरजेंसी में करवाया था क्योंकि उसको बहुत हाई पॉइंट में जॉन्डिस था। यहाँ पे आके मुझे इतना अच्छा ट्रीटमेंट मिला है कि मेरा बेबी आज फिट एंड फाइन है और हम जल्दी घर जाने वाले हैं।
We have regular classes to keep the staff updated about the latest cutting edge treatment and technology which helps your baby grow healthy.
Staff very पंक्चुअल। एक पॉइंट ऑफ टाइम शायद मैं किसी चीज़ के लिए भूल गई हूँ कि उसकी ड्रिप ख़त्म हो रही है, आप आके चेंज कर दीजिए, या उसको क्योंकि ब्लड भी ट्रांसफ्यूज़ किया था, तो बट वेरी पंक्चुअल स्टाफ, वेरी केयरिंग। सफाई के लिए भी उतने ही केयरफुल रहे हैं। रात को आई रिमेंबर मैंने एक बार रात को 12 बजे क्लीनिंग स्टाफ को कहा था कि आप प्लीज़ आके रूम क्लीन कर दीजिए क्योंकि विजिटर्स ज़्यादा थे उस दिन एंड दे डिड इट हैप्पीली। आई एम वेरी हैप्पी।
यहाँ के डॉक्टर्स बहुत फ्रेंडली हैं, तो बिल्कुल बोलने में कोई हेजिटेशन रहा ही नहीं कि उनसे बात करने में डर भी लगता हो। यहाँ का ट्रीटमेंट बच्चे को इतना अच्छा दिया है। यहाँ का स्टाफ सुपर्ब है, नीट एंड क्लीन, डिसिप्लिन, रूल एंड रेगुलेशन बहुत सुपर्ब है। मेरे लिए तो ये टेम्पल की तरह रहा है हॉस्पिटल, जहाँ पे आके मैंने अपने बच्चे की जान बचाई है दोबारा से।
On entering the NICU, the HR staff provides you a wristband and an NICU pass identifying you as a parent. Before entering the NICU, the parents are given a gown, a mask and a cap. Prior to entering the NICU, the visitor has to remove all the accessories like watches, jewelry, rings and have to scrub the hands for 2 minutes. On entering the NICU, the senior nursing staff guides you on how to precede your baby. Infection is a big concern in the newborn period. Hence, screening of the visitor becomes very important and only one visitor is allowed at the bedside of the baby. Here in our NICU, parents are not merely visitors but are partners in the child development. The focus is to provide complete family-centered care to the baby. The parents can talk to the child, hold them and spend time with them in our NICU. You become your baby's voice, which helps in the development of the brain. Hence, as a parent, you are an integral part of our team.
जैसा कि मैं देख रही हूँ कि काफ़ी स्टेट ऑफ द आर्ट टेक्नोलॉजी यूज़ की गई है बच्चों के ट्रीटमेंट के लिए। ऑफ कोर्स मेरा बेबी वाज ऑलमोस्ट 10 मंथ्स जब वो यहाँ पे आया था, 10-11 मंथ्स का, तो उसको इस इंफ्रास्ट्रक्चर की इतनी ज़रूरत नहीं पड़ी थी। बट जो मैं देख रही हूँ इक्विपमेंट्स भी काफ़ी अच्छे हैं, स्टेट ऑफ द आर्ट टेक्नोलॉजी है।
एडवांस तकनीक ਨਾਲ ਅਸੀਂ ਮਤਲਬ ਕਿ ਚਾਹੁੰਦੇ ਹਾਂ ਕਿ ਬੱਚੇ ਨੂੰ ਟ੍ਰੀਟ ਕਰੀਏ ਕਿ ਉਹਨੂੰ ਫਰਦਰ ਕੋਈ ਪ੍ਰੋਬਲਮ ਨਾ ਆਵੇ।
To achieve optimum result, we are geared up with special neonatal equipment such as radiant warmers that keeps the baby warm, monitor to see the baby's heart rate, breathing and blood pressure, pulse oximeter to see oxygen saturation in blood, intravenous pump to maintain the fluid level. In case the baby requires extra oxygen, then nasal prongs or oxygen hood is also used so that the baby can breathe easily. CPAP or ventilator is also used to give breathing support and oxygen. Some babies develop pneumothorax that can be relieved by putting tube in the chest. Babies who develop jaundice due to breakdown of RBC require phototherapy to reduce jaundice and prevent them from developing kernicterus, which can lead to brain damage. During the procedure, sometimes the baby may require exchange transfusion. Newborn babies can get affected by a few diseases and you as parents should also be aware of these. RDS. The baby born 34 weeks may have respiration distress syndrome, also known as hyaline membrane disease. It is a very common disease in the premature babies due to a deficiency of something called surfactant, TTN. It is more common in babies delivered by C-section because the baby did not get the birth canal squeeze. Fluid normally is squeezed out of the lung as the baby goes down the birth canal. The fluid is generally replaced by air. Babies delivered by C-section sometimes do not have a strong initial breathing and cry and may have leftover fluid that is removed by the lymphatic system gradually after the birth. Sometimes, though, the fluid remains in the lungs, making air exchange difficult. Your baby may need to be supported with some oxygen while the fluid is eliminated. Pneumonia. It is usually treated with antibiotics and oxygen, MAS or MAS. When the babies are under stress in uterus, they may pass stool, and when they breathe, they may take in the stool. The first stool is called meconium and is very dark, and when aspirated in the lungs, they can interfere with breathing, requiring a ventilator support. Sepsis. Since newborn babies, especially preterm babies, do not have matured, so when the infected organism enters in the bloodstream, it is called sepsis. This can be treated with antibiotics and other support measures. NEC. Sometimes your babies can show the signs of feeding intolerance, such as enlarged abdomen and vomiting. This is very common in preterm. The doctor may order to stop the feeding. Surfactant therapy is sometimes required for premature babies who have difficulty in breathing due to immaturity of lung. This is introduced through endotracheal directly to the lungs. Breastfeeding is another important aspect in NICU. Our lactate staff explains the mother the procedure to use breast pump. The expressed breast milk can be stored for 4 to 6 hours at room temperature and 4 to 6 days in refrigerators and 4 to 6 months in deep freezers. While traveling, it is suggested to the parents to use ice pack, and the milk should never be defrosted in hot water or in the microwave. The EBN then is given in the required quantity by tube to the preterm baby. It is a well-known fact that music therapy improve heart, sleep pattern, calories intake, and help in maintaining the parent-child bond. So we encourage music therapy at a hospital for better behavioral pattern and decreased hospital stay. So let us all work together as a team to help the newborn. For us here at hospital, it is not just a job, but it is our passion. What if the child was my own or my grandchild? That is how we think for every child brought here. Here we deliver the next generation of care with passion and love. We are committed to developmental care, a holistic approach to caring for the newborn as a special individual. Before we discharge the baby from our NICU, the baby undergoes ROP and hearing test by the specialist.
For me, the NICU is a story of love, compassion and tenderness. An amazing place where the miracles are survived. There is no other place like this.
It is for the cause of child health care that Dr. Kamal Mahajan Multi-Speciality Hospital was opened in the city of Amritsar. The services rendered are holistic in nature, keeping in tune with the great socio-cultural traditions of this city.
नींद भरी रे गुलाल भरी मेरे लाडल की अखियाँ, नींद भरी मेरे ललना की अखियाँ, नींद भरी। जगमग तारों की चुनरी ओढ़ी, निंदिया रानी आएगी दौड़ी, सपनों में आएगी सोन परी मेरे लाडले की अखियाँ, नींद भरी मेरे चलना